Today's drug is clonazepam, brand name Klonopin. The therapeutic class is an anticonvulsant, a benzodiazepine, or a hypnotic. Dosage form and strength. The medication comes as a tablet in a 0.5 mg, 1 mg, and 2 mg strength. There is also an orally disintegrating tablet that comes in a 0.125 mg, 0.25 mg, 1 mg, and 2 mg strength. Indications and dosing for adults. The first indication is for seizure disorders. The treatment range is between 0.5 and 5 mg by mouth 3 times daily. When initiating, start at 0.5 mg by mouth 3 times a day. Dose increases are between 0.5 and 1 mg per day every 3 days, up to a max of 20 mg per day. The next indication is for panic disorder. The treatment range is between 0.5 and 5 mg by mouth twice daily. When initiating, start at 0.25 mg by mouth 2 times a day. Dose increases are between 0.25 and 0.5 mg per day every 3 days, up to a max of 4 mg per day. There are many different off-label uses for clonazepam. The first is for anxiety. The treatment range is between 0.25 and 0.5 mg by mouth twice daily. Dose increases are at 0.25 mg per day every 1 to 2 days. The max is 4 mg per day. The next off-label indication is for restless leg syndrome. The treatment range is between 0.5 and 2 mg by mouth every night at bedtime, 30 minutes before bedtime. The next off-label use is for confusional arousals. The treatment range is between 0.5 and 2 mg by mouth every night at bedtime. The next off-label indications are sleep terrors or sleepwalking. The treatment range is between 0.5 to 2 mg by mouth at bedtime. And the next off-label use is for rapid eye movement sleep behavior disorder with a treatment range of 0.5 to 1 mg by mouth at bedtime. The next off-label indication is for burning mouth syndrome. The treatment range is between 0.25 to 2 mg per day. It's divided into 1 to 3 doses per day. Dose increases are between 0.25 to 0.5 mg per day every week. The last off-label indication for adults is for Tourette syndrome. The treatment range is between 0.25 to 3 mg per day with a max of 6 mg per day. Indications and dosing for pediatrics. The first indication is for seizure disorder. It's approved for children less than 10 years of age. Weight-based dosing for patients less than 30 kilograms has a treatment range of 0.1 to 0.2 mg per kilogram per day, taken by mouth and divided into 2 to 3 doses per day. When initiating, start at 0.01 to 0.03 mg per kilogram per day, divided into 2 to 3 doses per day. Dose increases are between 0.25 to 0.5 mg per day every 3 days. Regarding separated doses, give the largest dose at bedtime. For weight-based dosing for patients greater than 30 kilograms, the treatment range is 0.5 to 5 mg by mouth 3 times daily. Initiate at 0.5 mg 3 times daily with dose increases of 0.5 to 1 mg per day every 3 days. The max is 20 mg per day. There are several off-label uses for clonazepam in pediatrics as well. The first 2 are for sleep terrors and sleepwalking. They are both approved for children 2 years of age and older. The treatment range is between 0.125 and 0.25 mg by mouth at bedtime. Another off-label use in pediatrics is for rapid eye movement sleep behavior disorder. This is approved for children 2 years of age and older. The treatment range is between 0.25 and 0.5 mg by mouth at bedtime. The last off-label indication for clonazepam in pediatrics is for Tourette syndrome. It's approved for children 6 years of age and older. The treatment range is between 0.25 to 3 mg per day, divided into 2 to 3 doses per day. When initiating, slowly titrate the dose in 0.25 milligram per day increments, divided 2 to 3 times daily to a max of 6 milligrams per day. Mechanism of action and pharmacology. The exact mechanism of action is unknown, but proposed activity is believed to be a result of GABA activity enhancement. A depression of the nerve transmissions in the motor cortex occurs through a spike wave discharge suppression. Clonazepam is rapidly and completely absorbed. It's hepatically metabolized via the CYP3A4 pathway. Less than 2% is excreted in the urine as the unchanged drug. The onset of action is between 20 and 40 minutes. The time to peak is between 1 to 4 hours. In adults, the duration of action is less than or equal to 12 hours and between 6 to 8 hours in infants. In adults, the half-life elimination is between 17 and 60 hours, and in children, it's between 22 and 33 hours, while in neonates, it's between 22 and 81 hours. Clonazepam is 85% protein-bound. Special populations and considerations. In elderly, when initiating, consider starting at the lower end of the dosing range. Regarding discontinuing therapy, it is recommended to gradually dose increase by at least 0.25 milligrams per day every 3 days. For patients that are renally impaired, no adjustments are needed, but caution is advised. For patients with hepatic impairment, it is contraindicated if the impairment is severe. Contraindications and cautions are in severe hepatic impairment, renal impairment, CNS depression, history of seizures, and elderly or debilitated patients. Regarding pregnancy, there is limited human data. Risks versus benefits should be weighed. When looking at other benzodiazepines, there has been a risk of neonatal withdrawal symptoms. Regarding lactation, there is limited data. If a benzo is required, consider a short-acting one such as triazolam or monitor the infant closely. There is a risk of infant CNS depression. Side effects. Common side effects are drowsiness, dizziness, fatigue, depression, amnesia, confusion, constipation, hypotension, as well as others. Serious side effects are respiratory depression, abuse and dependency, hypotension, syncope, paradoxical CNS stimulation, as well as others. There are several black box warnings. The first is use with opioids. The second is for addiction, abuse, and misuse risk. And the third is for dependence and withdrawal reactions. Drug interactions. The considerations to make for drug interactions are for CNS depression, hypotensive effects, CYP3A4 substrates, and anti-epileptic agents. A couple of contraindicated drugs are bupropion and metoclopramide. Some other drugs of note are alprazolam, buprenorphine, butalbital, morphine, promethazine, tramadol, aripiprazole, and others. Monitoring parameters. Monitor for signs and symptoms of changes in behavior. Monitor for suicidality and depression, as well as monitoring the LFTs if long-term usage. Patient counseling information. Clonazepam is a longer-acting benzodiazepine used to treat seizures and panic attacks, along with many off-label uses such as restless leg syndrome, sleep terrors, and sleepwalking. There is a concern for addiction, abuse, and misuse, and usage with drugs that can cause CNS depression, such as alcohol and opioids. Exercise extreme caution for activities that require coordination, such as driving and operating machinery.